Hi, YouTubers. Welcome to another chapter of our coronavirus update. So, I'm going to entitle this video The Denominator Chapter 2. And what I want to talk about today is a phenomenon I've been wondering about, and I think I understand the answer of what's going on here is why isn't the death rate higher now, given the number of new cases per day that we're seeing? So, um, here it is. We're a few days after Election Day. We're hitting 120, 130, 140,000 new cases per day in the United States. The death rate is currently running somewhere between 1,100 and 1,200 plus per day in the United States. But the question I have is, uh, when we were running 60,000 cases a day on average during the first peak, we were having 3,000 deaths per day in the United States, and now we're only having 1,200 a day. Now, there are a couple factors to consider. One is that deaths lag the when you have an increase of new cases. It takes 4 to 6 weeks following the increase in new cases to see the deaths that follow. It takes that long for people to become infected, to become sick enough to be in the hospital, and then sick enough to die from it. So there's this lag time. So it's partly that, but it's more than that. Now, people have been attributing this to our improved treatment of coronavirus. And we have improved the treatment. We now have remdesivir. We're avoiding the hydroxychloroquine nonsense. We're using steroids and proning, better, more targeted intensive care. But we know that remdesivir doesn't work that well. We know the plasma treatments, convalescent plasma, doesn't work that well. We hope that it would work better. We're not sure yet about how well the Regeneron, the monoclonal antibodies, are going to work. Hopefully, they'll work better. But we don't know that yet. But yet we're seeing a drastic reduction in the death rate compared to what we were seeing earlier. And I thought about that a little bit, and I think the explanation is simply the denominator. Now, I did a video, and I'll provide a link in the description below, about this before. When the pandemic was first hitting, I was yelling and screaming. I said, "We've got to know the denominator." We were assuming this death rate was 3 to 5% from this infection, and yet we didn't know what the denominator, meaning how many people actually have the infection, because we didn't know about the mildly infected, the asymptomatic. We didn't know how many of those people were out there. Nobody was doing antibody surveys. Nobody was doing mass screening and testing. We had no idea. And so I said, we got to go out and do this testing and find out how much is out there. Because if all you're doing is saying the death rate of the very sickest, you just don't know what the death rate is. So, they finally did some antibody survey tests, and back in March, April, they determined that we were only detecting about 1 in 10 cases. So 9 in 10 people were running around not knowing they had coronavirus when they had it, and only the sickest people were being detected, and the death rate is measured against the people that are detected. So before it was 1 in 10. So now it's about maybe 1 in 5. So our testing is much, much better than it was before. we're probably detecting twice as many cases now of the total cases that exist than previously, but it's still crappy. We're still only getting maybe 1 in 5. So that means for every case we know about, there's 4 more running around out there that we don't know anything about. We don't know about them. And so the death rate again is still on what we're detecting. So it's kind of like inflation and the value of money. You've got, let's say you've got $100, but when 5 years has gone by, it can only buy what $50 bought before. Now you're detecting 100 cases, and you're finding 20 twice as much as you were finding previously, and that means you're picking up twice as many of the milder cases, the asymptomatic cases. Maybe you tested because they had a contact, or they were tested because in their job they have to get screened routinely. Let's say they work in a nursing home, so every week they get a test for that reason, and people are being found infected because of that. Whereas before these people weren't being tested that way. And so it looks like out of the total number of people who are getting tested, half of those are dying compared to before. Well, that's not due to remdesivir or convalescent plasma or steroids or anything like that. That's due to the fact that we're now detecting twice as many cases. The denominator, we're picking up more of the true denominator. And until we get the full denominator, we're still not going to know what the true death rate is to this virus. And so, the true death rate is going to be far lower than what we currently know. And you say, well, if that's the case, what's the big deal? Well, if you have 365 million people in the United States, it doesn't take much of a death rate to have millions of people die. And so, you can't dismiss this as it's not a problem, because it is. And already we've, lost 240,000 Americans to this virus, even though the death rate is probably far lower than what we currently think it is, because you've got millions of people becoming infected with it. And again, if you review my previous video, you'll realize that there are other diseases like meningococcal disease, which causes sepsis and meningitis, where you can have 20, 30, 40% of a given population carrying this germ and sort of semi-infected with it, who have no illness, no symptoms. But among that group, a certain percentage of them are going to get extremely ill and die from it, or have serious sequelae from it. And coronavirus is something like that, where you've got, the entire population is susceptible to it because nobody has been exposed to it previously. There's no immunity. And so we're all susceptible to getting it. And even if the death rate is low and the sequelae rate isn't 100%, if you've got 365 million people susceptible and the thing's extremely contagious and spreading through the population, a lot of people are going to get very sick and die from it. Again, so we're talking math here. It's the denominator. It's how many of these people are we detecting? And again, so just to recap, I'm now currently looking at the reason why, or a big portion of the reason why we're not seeing more deaths or a higher percentage of deaths, is because we are detecting more of the cases, more of the milder and asymptomatic cases. So it makes it look like we're doing better, that the death rate's lower. But I think it's simply because we're testing more. No, it's not like Donald Trump says we're creating new cases, we're causing new cases by testing. No, 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 no. It's nothing to do with that. You get it by exposure to a person who's infected, not because you were tested. The test simply reveals the infection. But if you are detecting a greater percentage of the infected population, it's going to make it appear, and rightly so, that per infected person, it is not is the percentage that die from it is lower. And so that's my take on it. Thanks for watching.